before.
So as an observer, you're squeezing the artery.
I'm squeezing the artery.
So it bulges.
Exactly.
So then you can see it and feel it better.
You did so good.
Hey guys, it's Kelsey and Maylee here from Sweet Briar Farm. Today we're taking you with us. We are going to be giving our does a mani-pedi day. They're going to get their nails done. And we are also going to be drawing some blood samples to send away for testing. So if you follow our channel, you'll know that biosecurity, keeping diseases off our farm is something that is very important to us. Yeah. So the 3 things I'm going to be testing my goats for, and I'm only testing goats over the age of 1 year old, and I'll tell you why. But the 3 things I'm testing my goats for are CL, caseous lymphatitis, CAE, caprine arthritic encephalitis, and Johne's. These are 3 diseases for which there are no cures, there's no treatment, and they're eventually lethal to goats. So these are 3 important things that you want to make sure are not on your farm. So we bought, all our goats came from herds that test for these 3 diseases every year and have negative test results. So I'm not nervous, I'm not expecting any positive results, but we're kind of just doing our due diligence to make sure that our goats are also all negative for these things. The tests that the labs can do are very good and they're very useful tests, but they're not always accurate. And I'll tell you about the 2 different ways that sometimes lab tests can be inaccurate. So sometimes you'll get false negative results. And those I think are much more common than the opposite, false positives, which I'll talk about next. But false negative test results are results when you get a negative test back from your herd, but the animal actually does have the disease. And that happens because these 3 diseases are things that take years to show up. So you can have goats that carry these diseases dormant within their bodies, but they're not sick. They don't show any symptoms. They're healthy. Their parents are healthy. Everybody else in the herd is healthy. But then when they reach a certain age or some kind of a trigger happens in their body, it snaps, yep, and they start to be sick, and that's when they're spreading the disease. So by testing our goats every year, if we're lucky, we can get a positive test result before an animal is infectious, and we can get them off our farm and keep the rest of our herd and our farm safe. Some of these diseases, like Johne's especially, can actually contaminate the soil on your farm for years. And so that's one that's really serious that we're really watching for, and that's one that can spread between goats and cattle. So you know we also raise cattle. And Johne's is also linked with the research is in very early stages. We don't have any definitive answers, but there's some links or things that are making scientists suspicious about Johne's positive animals and humans who consume their milk developing Crohn's disease. So that's something we want to make sure we keep off our farm. I said there were 2 types of lab results that might be inaccurate. So the false negatives are a reason why we retest year after year after year. Just in case we're getting false negatives, we want to make sure we catch it before it's a problem. The other type of erroneous test result is a false positive. And that's why I'm not testing my kids who are less than a year old. It's very rare, but kids under the age of 9 months have a higher chance of having a false positive test. That would be where you get a goat that comes back with a positive test result from one of these, but they're not actually sick. It's incredibly rare, but there's something about kids that makes them more likely to have those kinds of test results, which is why we wait to test any of our goats until they're over a year, just to make sure. So if I do see a positive test result on a goat that's over a year old, then that's something that's making me really suspicious. And we'd do further testing and follow up and consult with our veterinarian and figure out what to do if we ever find ourselves in that situation, but hopefully we don't. Okay, so today we're gonna bring the does in on the milk stand. We're gonna trim their nails, check them out, check out their body conditions, their eyelids. Gonna take a little bit of blood. Yep. And so we're just gonna kind of take care of everybody today. So we're gonna get started. I'm not gonna show you every single goat, but we'll show you the first few so you get the gist of what's going on. And just for the record, I have only done blood draws 2 years, and I've always had a more experienced friend helping me out. So we'll see how this goes. Maylee's an excellent vet in training here, but we'll see how it goes. I think it'll be fine. All right, let's go grab Nellie. She's up first. All right, so I'm gonna do Nellie's feet first. All right, so Nellie's hooves are all done now. I'm gonna shave a spot on her neck by her carotid veins so that I can see them clearly for when I need to get the needle in there to do the blood draw. Okay, so I've got Nellie's neck shaved.
Hey guys, so Natalie Kochnar is here with us today visiting. She brought a couple of her gilts up to be bred by our boar Stedman, and she's also given me a hand since I don't have a ton of experience yet doing goat blood draws, so I'm super grateful and excited to see my friend today.
Yes, it was great to see you in this lovely cold Michigan weather.
Yeah.
Happy to help.
Thank you.
You're welcome.
I do need it.
So yeah, what I find is milk stand is hard. It's hard to draw your own blood in the milk stand because right where you want to be is where their neck is.
All right.
I block it off bilateral, so I do it on both sides just because it's easier for me than trying to. And then I always see how she's pushing forward.
Yeah.
And she's gonna do that as soon as we poke her too.
Yep.
So,
would it be easier? Because Mike's always around. I can, like if it's easier to have one person hold the neck up and away.
If Mike's always around, I can tell it will absolutely be easier.
Congratulations, you get to participate in the training today.
Well, Carrie can help, and then Mike can do the yeah.
I need help.
So,
You need a collar.
I can hold a goat in the future.
okay, friend. Sorry, you got your free meal. I would do it on the ground.
Okay.
I'll try to get the little goat out.
Let's go outside where you got natural
There's
light.
nothing little about that goat.
Short. All right. So when you go to hold for blood draws, you want to hold their collar for whomever is so this is just from the holding standpoint. You're gonna hold the collar and you're gonna kind of hold them up and almost turn their head.
Okay.
And then usually whoever's drawing can say like up, down, and it's just based off of positional on the jugular. Blah. So because I worked in a small animal clinic, when I do it, I tap, and it's just habit, and it just kind of keeps them less. Yeah. So if you want to try first,
Sure.
let me get on the other side for you, or I'll just straddle her. So I'm holding your collar out of your way. I'm holding your head turned, and then you're gonna hold the jugular. So when you go ahead and push so you can see it and feel it. So go ahead and let go, and then go ahead and do it again and see how it pops.
Yeah.
I might be able to hold it for you. Bevel up.
Yep.
Nice.
Whoa.
Good work.
Good girl, Nellie Belly.
And then if the holder can clot off, it just makes it easier for the drawer.
What do you mean clot off? Just hold it?
So just hold it, because you are hitting a main.
Okay.
You know, yeah. And I would get that into your rib top quick-ish. I think it can clot. I can't remember. That was awesome. Yeah, you rocked that.
Yeah, Mom, you did. That's way different than the last time we did it.
Well, yeah, it's really hard on the stand. I'm telling you, it's hard on the stand.
Well,
You just don't have the...
before, didn't you?
I did with Carl last year, but we did it this way.
Yeah,
Oh.
it's hard on the stand. I struggle.
Oh, you did it this way holding?
Yeah.
Oh.
Carl would hold the goats and I did it.
Why didn't you hold the goat?
Nellie's.
Oh, it's a Nelly problem? Also, if they're fat, it's hard because you can't see it anymore. All right, so we're going to do one without a shave so you can practice. You get it. You'll have it.
Oh, we're gonna get you back too, okay? And then we're going to
No, you're gonna stay in.
Is that just always out?
She jumps. I don't know how she got out today.
we had the thing open because we were scooping it out.
Oh,
Yeah, and she. That fat
but
little goat.
that window that's boarded shut, normally that's open in the summertime. So she'll jump up on the windowsill and then come out. So she's out a lot.
Yeah, she's out. She's a free range goat.
Yeah, but she doesn't cause any trouble. It's
So cold.
It is really cold.
like a little bit of dampness in the air or something that makes it feel colder.
It's a little hard to breathe too, almost.
She got skills.
Don't take me for a ride.
She's gonna be hard to hold.
Don't take me for a No, it's alright. She can throw a fit all she wants.
Mom, I'm not easily intimidated, love bug.
Mom, she's out.
I don't think you can get her right there.
Oh no. So we saw Ladybug get bred today, and now she's hiding in the corner, so the bull leaves her alone. So she's not shaved?
She is not shaved, so use your alcohol. Use it as your way to like wet down her coat so you can visualize better. And then a lot of people will part where they think the jugular is, and then use your finger to just kind of like go from there. Oh, you're gonna go on this side. Sorry.
I guess it's habit at this point.
It's fine. I just because I'm a lefty, I think I just. Hey. Oh yeah, she's feisty. You're actually fine. She's poking it out at the side of her mouth. What are you doing?
I think that one right here.
Yep, it's right here. See how fat it was?
Yeah.
And it went away.
Okay, baby. It's okay.
So yep, remember when you start low, you have more leeway to go up.
She's napping over there.
Beautiful.
Are you just letting it fill up, or are you pulling?
I'm pulling.
Oh.
But if you've got it in good, it fills very easily. There isn't a lot of pressure to it. Oh, here's a needle cap.
Oh, thank you. I'll come back for that.
You're fine. You're gonna take me for a ride now. Stay.
She thought she was gonna get.
She is nice work.
So you're gonna, so actually, we're gonna put her butt against this. Because she's gonna back right out of you.
Okay.
If given the option. Come on, sweet girl. Whoops, sorry. So you go ahead and straddle her. And then you're gonna hold the collar for mom. And you're gonna hold her head up, even though she's gonna fight you. And you're gonna tilt it whatever opposite direction. So if mom's on this side, she'll go this way. If mom's on this side, she'll go this way.
Okay.
So you don't want her nose to be up in the air like this. You kind of want her to be like that.
Okay.
Does that make sense? Okay. Perfect.
She's.
And then your job is to communicate. Put her nose a little down. Put, you know.
Yeah.
It's okay.
Yep, so it should
right
be.
I think she'll. If she.
She fuzzy. Can you
She's
feel the
really
difference?
fuzzy.
When I release it when I
It's
start?
okay.
Yeah.
If she takes off, I'm gonna ride with her.
Ready? So don't be afraid to like kind of almost move the needle. Like once you've poked in, you can rotate it
Okay.
and you can kind of try to go deeper.
Okay.
Just like you're already there. You didn't get a flash, so we didn't get it.
Okay.
Can you put her nose down just a touch for me here?
She's
Right here.
Yeah.
forcing herself
Yeah.
up. Told you this one would be difficult.
She's actually being pretty good.
You got her, Carrie? Yeah. So if I can help on this end instead of trying to control her butt too. Let's see. She's also like dropping her weight.
Yeah, she's like I can feel her like going lower, and I'm like, why?
Stab it, girlfriend.
Oh, it's okay.
So that's part of why you're having such a hard time. She's like she's straightening her neck so much that she's flattening that vessel. So she's gonna be hard to feel.
It's okay, baby. I got you.
You feel it on that side? You might even neutral. She might be, because she's forcing it so bad, you might even have to just, there you go. Just say,
Oh, you got her. Okay,
yeah.
good.
So as an observer, you're squeezing the artery
I'm squeezing the artery.
so it bulges.
Exactly.
So then you can see it and feel it better.
You did
Yeah.
so good.
So just like when they put a tourniquet on your arm at the doctor's office when you go to draw blood
Felt her, like,
and you release it. So really ideally,
off and I'm gonna go with
in an ideal world, Kelsey and I should be communicating that she's almost done, or I need to be like letting go of the vessel when she's almost full, because I'm helping push. it's helping force that blood in. So for this doe, because of the way she's angling her body, where she's like dropping her legs and pulling her neck, I would almost neutralize her head instead of turning it, because then it's flattening the vessel. I would almost keep her more head neutral, because I think you'll get more visibility.
Like every day.
Yeah, she's a good girl. I like her a lot.
Yeah, she's
Like, hi mom, do I get a cookie?
You did a good job.
You did do a good job.
Okay, so I've got Lacey J up here. I just did her nails. I mentioned she was the one goat I want to use a dewormer on. I'll have to do a whole episode on goats and dewormers. You don't want to worm your goats the way that you might other livestock, and we'll explain why in another video. But Lacey here has earned it. She's an older doe. I think she's going to be 9 this spring. She's been losing body condition, so she's skinny. And skinny on a goat, I'm not talking about their belly, because that's their rumen. But like when I pet her on her back, I can feel her spine a little bit. I can feel her ribs and her shoulder bones sticking out more than I have in the past. So she's losing weight, which she's an older doe. She's at the bottom of the hierarchy, so she's one of the last ones who gets to eat often. So we've had her in the barn, letting her kind of pork out without competition. But I've also checked her eyelids. So if you were like pull down your eyelid on a goat and look, a really healthy goat has a nice bright red skin flesh under that inside of the eyelid. And certain worms, not all worms, but barber pole worm and coccidia can make goats anemic. And anemic goats can go downhill fast. So that's one of the reasons you check eyelids for goats, is you're checking for anemia. And Lacey's eyelids are very light pink, so she's okay. But I'm thinking since she's losing weight, she's older, we just had a really harsh cold spell, and her eyelids are light pink, she could probably do with a little help from a dewormer. So I'm going to give her some valbazen. It's albendazole, and this happens to be the wormer I have in the cupboard, but it's effective against a lot of different types of worms, not coccidia. And I don't suspect that coccidia is Lacey's problem because she's an older doe. That's usually a problem we see with kids. And if Lacey was really sick and having a hard time, I would send a fecal sample off to my vet. But since it's just one doe who's having a problem, I feel comfortable giving her a dewormer just to her. So the goat dose, Lacey's probably a little more than 50 pounds, so I'm gonna give her about 2 milliliters of valbazen. It's really easy to do, it just goes right in her mouth. So I don't think it tastes great, but it does work well when they need it. You go, baby girl. You're good. Oh, what'd you do? Nothing. She's just lazy. There you go. All done.
You got it.
Okay, so that's it. And I'll keep a close eye on her and keep watching her condition, and if she doesn't improve, then I probably will send a fecal sample off to my vet to see if there's something more we need to do for her. But she's doing just fine, so I think this is just all she needs to get back on track. Thank you guys for watching. Please make sure you guys subscribe and stay tuned for more fun on Sweet Briar Farm. Thanks, guys.